transition program called 30/30. Tell us about the origin of that and how it works.
Sure. Well, I mentioned earlier that Tara and I had done a similar project when we were working for a hospital system here locally, and when we saw those results were so positive, we've now developed our own 30/30 program. So we follow patients coming out of skilled or hospital settings. It could be a skilled nursing facility, a rehab facility, or a hospital. Typically, they're 65 or older, and we track them for 30 days. So our tracking is done through case management, through a substantially discounted home care rate, and a piece of technology that we had recently piloted for a large organization in Northern California. And it's a real-time charting for patients. So our caregivers are able to use this app and text myself or the other case manager as to urgent matters. For instance, they arrive at a home, medications haven't been taken, or behaviors are changed, maybe indicators are that there could be a possible infection going on. It's actual real-time charting to us. The idea is to stay ahead of the problems, to mitigate any problems that might lead them back into the hospital. We then report it to whomever the point of contact would be. Is it a case manager at the facility? Is it a family member? Is it a home health or hospice? And so during that 30 days, our whole goal is to keep these people home and not have them readmitted. Currently, we're the only home care agency anywhere ever that has this product, and we're so humbled by the fact that they let us pilot it, and now we've launched it.
That's awesome.
It's exciting.
So 30 days. So let's kind of recap. So it's tracking for 30 days, and it's really providing sort of the glue between you and the family and the facility. It's giving you, like you said, the real-time information, which without it, I mean, what would people do if they didn't have that type of technology?
Well, for instance, now, the way that our agency, or most agencies that do case management as well, work is that the caregivers, they chart. We all have a patient tracking system of some type on our phones and in our computer systems, but it doesn't get reported immediately. So the delay of maybe a day or two of getting information that we think is pertinent,
it can make all the difference.
It can make all the difference. And this particular app, we can go back in history. So let's say we find that somebody historically hasn't taken medications for 3 days. We can do a look back and see the patterns and work with the physicians or the clinicians on what the best approach would be.
Got it.
Yeah.
So you just started the program.
We did.
You piloted it. Now it's going to be kind of a full-scale deal. What do you expect to see over the next few months as far as care for seniors?
Well, I see that once we start tracking it again, like we did before, you will see a substantial difference in those bounce backs. And so it allows us to work very closely, very intimately with the case managers inside of facilities. And they want to know if there's a skilled nursing facility who discharges a patient and that person goes back to the hospital, we stay in communication with the social workers from the skilled nursing facility and let them know that they've returned so they can